And I've got the great privilege of being the Chief Executive of Multicultural New South Wales, where we engage extensively with the communities to make sure their voice and lived experience is heard and understood right across the New South Wales Government. For the past 12 months, we have walked shoulder to shoulder with our incredibly culturally diverse community of New South Wales to help them navigate a once-in-a-100-year pandemic. The fact that our community has been so willing to help disseminate the health advice, get vaccinated and really champion positive government messaging right across the entire state is largely because of the collective efforts of all of you, all of our public servants across the state, but also the wonderful trust and social capital that we've built with these great community and these leaders and religious leaders over the past 40 years.
When I had the opportunity to work at Kudos Bank Arena and lead the team there, we were able to vaccinate over 340,000 recipients in over a 13-week period. This was great because we were really able to contribute and support the community and bringing the community back to normality and really helping to end the lockdowns. I do share this category with a couple of my colleagues from Western Sydney Local Health District, and it's also an honour to be there with them.
The Opera House is a gift built to serve the community. We have about 11 million visitors to the site. We put on about 2,000 shows attended by 1.8 million people. 700,000 people pay to take a guided tour, and thousands more join us online. It's been absolutely fantastic over the last 10 years to be able to renew this building for future generations, and now on our 50th anniversary to open it up for the whole community is more than special. It's extraordinary.
My role as the Northern New South Wales Welfare Services Functional Area Coordinator is to establish and coordinate evacuation centres and ensure the effective delivery of disaster welfare services between the Clarence Valley and Tweed Heads. What's special about my role is that I'm able to support disaster-affected communities, providing comfort, immediate assistance and guidance through a really difficult time in their lives. I'm able to advocate and ensure the safety and care of these communities and people within our evacuation centres. I work with a wonderful team where we're able to embrace challenges together and work through these in order to achieve positive outcomes for our communities.
We're responsible for looking at the health and well-being of the community from a population health level, focusing on protecting, promoting and preventing illness, particularly infectious diseases and chronic diseases within the community. Working for New South Wales Government means I get to work with an amazing diverse variety of individuals. It means working for the community and the people that we serve. It's looking at what their needs are, looking at how we can meet those needs, and being able to have the community go with us on this journey to finding good health and well-being as a community.
Since the Delta outbreak in July 2021, I had the opportunity to work as the medical lead of COVID in Touch, which was our response in Western Sydney to COVID-19 and to manage COVID-19 in the community at a pandemic level. We didn't just focus on COVID-19 and that care, but also addressed health literacy around COVID-19 and home isolation, around the social needs of the patients, and calling our patients every day to check in on them and making sure they were safe. We actually simply reviewed and debriefed about every patient every day to make sure we're learning from each patient to provide better care the next day. We've now delivered care for over 40,000 patients.